and welcome to WRPB and WRPB Studios. If you hate dealing with me or listening to me, you could blame the guy next to me, because he's probably one of the reasons I'm alive and still here. With me is Dr. Richard Callison, and you are a neurointerventionalist.
Yes,
Did I
sir.
get it right?
Yes, sir.
At my age, with everything I went through, I don't always get it right. All right, so people have been following me for 30 years, and I've been through losing 40% of my lung function in 2010, a heart attack and triple bypass in 2020, and two strokes. I guess I had when I came to you, which was my second stroke.
Yes, sir.
Was that considered a stroke?
Yes, sir.
Okay, so how long are you doing what you're doing?
I've been doing this about 15 years now.
All right, why'd you get into this?
So I've always been fascinated with the brain. When I actually made the decision to go to medical school while I was in high school, and I went straight from high school to a 6-year combined BA MD program. So I graduated in 6 years as opposed to 8.
Oh, wow.
I've always been fascinated with the brain. Initially, I thought about going into psychiatry, and I did 9 months of research in bipolar disorder. And what I learned from that was that I didn't want to go into psychiatry. So the next logical step was neuro. And ultimately, I ended up getting involved in neurocritical care and stroke care, and got into a pathway where it was really the cutting edge of neurosciences, where now we can take wires and catheters up into people's brain and make them normal again after they're having a stroke. So,
You know, so I have the surgery, the first surgery, and they went through my neck, and I look like, I said this before, if you guys listen to any of my shows, that I look like I was pulled into an alley, beaten up, and they tried to slit my throat. When I came into you, when I came to Lawnwood that night, I was like, it was like 5 seconds that my arm was trembling, but because I have great insurance, I said, I'm going anyway. And when you said that you're not letting me leave, we got in surgery tonight, I was like kind of taken back because I didn't think it was anything of it. And when I was pulled into the operating room, I didn't know that I couldn't be put under. And the thing that was most shocking to me, which I'm surprised I didn't have another stroke, was when they strapped down my arms. Okay? When they strapped down my arms, I was like, really? But really, the truth of the matter is, I felt like I got 2 shots in my leg. Barely felt it.
mm-hmm.
And I think, so I got lidocaine,
Mm-hmm.
and then I had a drip of fentanyl.
Mm-hmm.
And I was up, and I was talking to you guys and watching on this, I don't know, 100-inch screen of what you were doing. Not that I really remember much, but I was thinking when you were done, I guess because you went in through the artery
Mm-hmm.
down in the groin area,
Right.
it took almost as long for them to hold pressure on that artery as it did for the whole thing that you did.
Yeah.
And then they put a bandage on it. And then here I was, nerve-wracking, thinking about my neck and thinking, oh my God. And I waited about a week to take that bandage off.
Mm-hmm.
And when I took the bandage off, it's a pinhole.
Mm-hmm.
It was like nothing.
Yeah.
I mean, is that like new, that kind of procedure?
Yeah. So the angiographic procedures have been around for a long time. The first angiogram was actually done in 1929. But this new technology where we can actually go and repair things in this fashion has really just exploded in the last 10, 15 years. And it's really kind of the cutting edge of neurosciences. Not only can we stop a stroke in its tracks, but we can also go in and repair aneurysms or repair blood vessel malformations in the brain that can kill people in an instant. So This technology is just really taken off in the last few years.
So you went into the groin area, and whatever this wire was, for lack of a better word, you went into my neck, into my carotid artery,
Yes, sir.
and in there they had put a stent, correct?
Yes.
Did that stent save me from having a bigger heart attack?
Bigger stroke.
A bigger stroke, I'm sorry.
Yeah. So basically, what we found when we got in there was there was a giant clot that was sitting in there, and basically obstructing blood flow to the brain. And part of that clot was just basically flaking off and going downstream. Had you not done the right thing by coming into the emergency room, now you felt like it was a quote unquote nothing thing.
Right.
But that it can be something as simple as somebody's arm going numb, somebody's leg going numb, or not being able to talk, not being able to see for an instant. That can be the sign of a stroke. In you had had the prior stroke, so you were in tune to that, and you knew what was going on, and you did absolutely the right thing by coming in and getting checked out.
I was told, everybody says, yeah, those times you rest on your arm, it goes numb. I said, you're worrying yourself by going to the hospital. I said, yeah, I have insurance. I'm going to the hospital. Like I said, I had a heart attack. If I had this thought to, what would you rather have, a heart attack or a stroke? I would take a heart attack every day, over and over and over again, compared to a stroke. The stroke is so unsure. No real signs. The first stroke, I was just walking in the farmer's market, pulling a cart, and it fell out of my hand.
Yeah.
Now, there are things that happen, and I'm not a doctor, but there are things that happen that I've learned. One thing I've learned anyway when it comes to medical is, no disrespect, but you're in a medical practice. The word practice is there. You don't have all the answers.
I say that all the time.
Do you? So you have to advocate for yourself. Okay? And that's so important. I was just telling you, I take my blood pressure 3 times a day. People would not do that. Now, I've had a hard time changing my diet, but I think that was a priority. And I think I don't have to give up what I ate. I just have to change some of it in moderation. The meat and potatoes can't be every day. The donuts, which were every day, had to stop. But that's a trigger for me.
Right.
Chocolate's a trigger for me. How does one know, or does one know, when you got to go to the hospital?
So I tell people, and this is straight off the American Heart Association website, sudden onset of any of those things I just discussed. Sudden onset of weakness in one arm or one leg, one side of your body, sudden onset of numbness on one side of your body, suddenly lose vision in one eye or both eyes, suddenly start walking like you're drunk or talking like you're drunk and not be drunk. I always have to preface that. And a sudden, very, very severe cataclysmic headache. This isn't like a normal headache. This comes on all of a sudden, and it's catastrophic. It's the worst headache that you've had. It's the worst hangover that you've had multiplied by 1,000. That can be a sign that you've had either a ruptured aneurysm or a hemorrhage into the brain. But the key to all this is recognizing that it's going on and seeking medical attention. When you're having a stroke, the brain dies at a rate of 3 million neurons a minute. So it is, we talk about how important it is from a time standpoint in the heart. Well, the brain dies at a rate 10 times faster than the heart. So if you're not actually getting there and getting blood flow restored to the brain, then it can be catastrophic, and we can't reverse the symptoms. But the sooner we get to it, the better off somebody's going to be.
I was blessed. I took my mom out of assisted living, and she'd get UTI. She was 88, 89, 90. And I take her to the hospital, and while they're prepping her, I'd be in the waiting room reading the signs on the wall. on the sign. That's on every hospital. Every wall is FAST. Face, arm, speech, time. I knew something was wrong when I was pulling that card. It fell out of my hand. I got to the hospital in 15 minutes. Didn't call an ambulance. My wife drove me because it would take longer for the ambulance to get there, pick me up, and then drive me back when I already had a car and someone else to drive. I didn't go to a stroke hospital because I went to the nearest hospital, and they did a teleconference, I guess, video teleconference with a stroke specialist, and he explained to me about a TPA shot, which is a miracle drug,
Yes.
and he explained to me the pros and the cons, and of course there were no real cons compared to what the pros. So I took the shot, had to stay in bed for 24 hours, and the flat out words were, Wayne, if you bleed, you're bleeding out. There's nothing we can do to stop it. You're over. The stroke affected me from my shoulder to my fingertips. And I think, I'm going to guess, because I got that shot, it stopped the rest from getting worse.
Yep.
And then I was lucky. I mean, I got in. After the 3 days in the hospital, I went to rehab right away. I spent 3 hours a day in PT and OT, even though I didn't do PT because I didn't need PT. I was released from there with the okay to drive because I didn't have any other issues.
Right.
My face, for you guys who know me a long time, kind of droops on one side. So everybody says, "Oh, look at." No, that's been my whole life. The only leftovers for me is essential tremors in my hand. Thank God I'm a lefty and it's in my right hand. And I was told that it could take 6 months to a year for that to possibly go away. And you'd be back to, I'm at like 85%, 90% now. My neurologist said, there's no pills or anything to take for essential tremors. He said, what you can try, and they say it works, is drinking a glass of wine, red wine. Why is red wine, I mean, they tell you red wine is good for your arteries and stuff normally. I don't drink and really never have. But now I'm drinking red wine. I look at red wine like medicine because I don't like alcohol.
Yeah.
Why do they think that works?
It's the specific receptors inside the brain that the red wine affects. And there are a class of drugs called benzodiazepines that also affect those same areas. And those drugs will work for essential tremor as well. And then there's other drugs like primidone that are barbiturates that also work on those same receptors and calm that tremor action of the arm. In you, I would actually expect that to improve substantially or even go away entirely.
It's only in my fingers.
Yeah.
My pinky. Okay, and it's not all the time.
Yeah.
It's when I'm holding things in a certain way or whatever. And they say, Wayne, it's not in your hand, it's actually in your brain.
Right.
Is that where it comes from?
That's exactly where it comes from.
It's, it's so weird the way the body works. Look, 3 days after I was done with you and out of the hospital, I was out and about. And I was getting calls saying, you have a death wish? You need to rest. You need to rest. But I think mentally it's important to do things and have for someone like me who's a socialite and always out, I think mental health affects your physical health. Okay? I actually thought I was having Parkinson's, but the neurologist said no, Parkinson's, when you get Parkinson's, you tremble all the time.
Right.
Okay? I don't have that.
Right.
If, like I said, why was, like, I came to the hospital, I only had like 5-second shake on my arms, and why was it so imperative that I had surgery that night, even though you had changed out of your pajamas and were ready to go home?
It's halfway out the door.
Okay. Why was it so important I had surgery that night and not the next day?
Because that clot that was sitting there in that artery was tremendously unstable. And when we got in there and we took pictures of it, you could actually see the clot wavering back and forth as blood was flowing past it. And that clot was enough to basically block off 100% of the blood flow to the left side of your brain.
So it's not because you needed a new boat.
No, it's not because I needed a new boat.
Okay, all right. I just want to make sure.
Yeah, yep. No. And it was, had that clot broken loose and ended up downstream physically in your brain and not just halfway up your neck, it would have killed you.
Wow.
Or left you in a worse condition than death.
So when I got there, they did a whole bunch of tests.
Mm-hmm.
Did they only check my left side carotid artery?
No, we looked at everything.
So my right side initially was pretty clear.
Yes.
Okay, and they had done prior to there when I was in the hospital before they did. I think in the hospital before they did my heart, and they did the back of my heart, which was also an interesting scenario.
Mm-hmm.
Because I don't think anybody thinks that they need a picture of the back of your heart as well as the front of your heart.
Yeah. So that's looking for another type of stroke. So there's the most common cause of stroke in individuals over 65 is atrial fibrillation or cardioembolic stroke. And looking at the back of the heart allows us to look at the part of the heart where blood clots can form in atrial fibrillation. So what atrial fibrillation is where the top part of the heart does not beat properly or it fibrillates and it quivers instead of pumping and contracting. So when the top part of the heart doesn't contract properly, blood can pool in that area called the atrium. Anytime blood pools anywhere in the body, it can form a blood clot. So if a blood clot forms in the heart, then it can be propelled out of the heart. If it gets propelled up into the brain, it can cause somebody to have a stroke.
So I had triple bypass, which means they went in and did surgery. When you heal from a surgery, do you open yourself up to blood clots that will break off where it heals too?
You do, and when you have a triple bypass, after the surgery, when it's safe from a surgical standpoint and a bleeding standpoint, they'll put you on blood thinners in order to prevent those different types of blood clots. A lot of times when surgeons do a bypass nowadays, they do what's called an atrial appendage ligation. And what that is because they're in there and because people that have had a bypass or a heart attack are at risk for developing atrial fibrillation in the future, the surgeon goes and ligates the part of the heart where those blood clots can commonly form. And that eliminates or drastically reduces the risk of a blood clot from atrial fibrillation.
Okay, so we know that when you have a stroke, time is everything.
Mm-hmm.
While you're having a stroke. Is time everything after a stroke also? Meaning the longer you go without another stroke or another action, the better shot you have of not getting.
Yes, yeah. So your highest risk of a recurrent stroke after a stroke.
Well, 6 days for me. Okay.
The highest risk is actually within the first 48 hours.
Okay.
And then the risk decreases substantially as time goes on. Somebody that has had a stroke is always at higher risk for going on and having another stroke in the future.
And what I was told, and you can correct me if I'm wrong, is that if you have a stroke and don't do anything about it, there's a 50% chance you can have another stroke. If you do something about it, you're reducing that to 1 to 5%.
Correct, and it again, it depends on the etiology or the cause for the stroke. In you, we know it came from your carotid artery. Your carotid artery was globbed up with
Right.
with plaque and got repaired, and then had a blood clot form there, and that got repaired. In other instances, such as the risk of stroke from atrial fibrillation. Rounding off, the risk of stroke from atrial fibrillation is anywhere from 8 to 10% per year. And if you don't take anything to reduce that risk, it's a cumulative risk over time. So if you live with atrial fibrillation for 10 years and don't do anything to reduce that risk, your risk of having a stroke is essentially 100%.
Wow.
And drugs like Eliquis or Xarelto or Coumadin reduce that risk by 80 to 90%. So they do a really, really good job at reducing that risk. We know that by operating on a carotid artery, we also substantially reduce that risk going forward. Not down to zero, but far, far better, less than 1% going forward.
You know, it's interesting because whatever happens on your left side really affects your right side, and vice versa.
Yeah.
I was lucky, and I wasn't lucky, but I was kind of lucky that it was on my left side because I'm a lefty.
Right.
So, and the only negative is that I'm a lefty and my right hand wasn't working right. But if you don't work on it, you lose it.
Yeah.
So, I put the time and effort into it. And I mean, when I had my stroke, my hand was just here. I didn't even know it was there.
Yeah.
And as things started to come back and they asked me, for me, what my goals were, I said, I drive in Florida. When I can give somebody the finger with my right hand, I'm healing. That's how I looked at it. Okay. Well, because it got better and I was able to move it, but I couldn't turn it.
Right.
Okay. And slowly these things came back. And it's still, if I use my mouse, it'll accidentally push buttons that I shouldn't push. It doesn't have the strength that it used to have. But I can lift things. It's ironic because I remember when it was getting better and I'd pick up a glass, I was fine. When I put it down, if I didn't think, I wouldn't know to open my hands up to let it go. So I'd pull it along with me and drop it. So it's really interesting how important it is to look at all these things. Somebody has a stroke, like me. Is there anything extra that they should consider or do? I changed my diet, which was the hardest thing for me. Is there foods that they should eat? Is there foods that they should not eat? Or it doesn't really matter what you eat as long as you do it in moderation? I mean, we were just talking, I like ice cream. My wife yells at me when I say I want to get ice cream, and she says no. But I don't think there's anything wrong with having ice cream if I have it once every couple of weeks in moderation. We went from drinking regular milk, and not that I drank so much of it, to drinking almond milk. I mean, was that a better move?
So the key to stroke is prevention, and the key to prevention is risk factor modification. Doing the things to prevent a stroke in the future, controlling your blood pressure, if you're diabetic, controlling your blood sugars, watching your cholesterol, taking your statin, taking your blood thinners. The newer recommendations or the newer risk factors for stroke are obesity and physical inactivity. So controlling those things, having a daily exercise program is really key to those types of things in the future.
Yeah, I took all of the clothes that were hanging on my treadmill off, and I started it. But because I have a lung illness, it makes it a little harder.
Yeah.
So I do like 5 or 8 minutes,
Yeah.
like 3 times a day.
Yep.
My wife hawks me about eating vegetables, but I don't eat vegetables per se. But I eat red meat maybe once a week.
Yeah. Anything is okay. I tell this to all of my patients. Anything is okay in moderation. Just because you've had a stroke or a heart attack doesn't mean that you can never have a hamburger or a steak again. Now, having a steak 7 nights a week is probably not the best thing for your cholesterol. But it doesn't mean that you can't have that again. Having a bowl of ice cream once a week is not a big deal, especially if you're not diabetic. Looking at all those things, anything is fine in moderation. So, keeping that in consideration is really key.
I went out and I bought a smartwatch
Mhm.
because it has fall detection. Ironically enough, I was calling my friend in New Jersey, and I called him like 5 times with no answer. Finally, his wife called me back. He had had a stroke, fell in his driveway, and no one found him for 3 hours.
Wow.
So he can't talk, and he's walking, but he can't walk perfectly. I don't know if you, in Lawnwood, Melissa Daly, I don't know if you know her.
Mm-hmm.
So Melissa, I met her a couple times. According to what I heard, they didn't find her for 3 days.
Right.
Okay? So timing is everything.
Everything.
And I didn't just buy a smartwatch. I bought the Galaxy 5 smartwatch, which was supposedly the best. Do I believe in it doing my blood pressure? I don't buy in that. Those things, even with the blood pressure machines you buy in the store, even with the blood pressure machines that the doctors have in their office, they're just a gauge. Especially in the doctor's office, because you have white coat syndrome. So if the blood pressure is off by 3 or 5 numbers, and you're in a doctor's office, that's off by 6. That's 10 numbers, 11 numbers that you're off by. You should definitely buy your own blood pressure machine. They're not expensive, and when you get older, I'm 66. There are things that's just so important. My wife wouldn't let me drive until I got this watch, because I'm out by myself a lot. So I really try to watch. For me, I was blessed. I had the stroke. I knew to get to the hospital. I was taken care of by great people. I got this second warning, which turned out to be a stroke, and I was blessed that he got out of his pajamas, but was able to get back in his pajamas. Okay, and wouldn't let me leave. Okay, a lot of people would have felt 5-second or 3-second tingle in their arm, and say, "Yeah, it'll go away. Yeah, it'll go away."
Yeah.
And I'm lucky enough. People say, "Well, you can't worry about every little." Yeah, I got insurance. I worry about it. I'm going to the hospital.
Right.
Okay, if it doesn't come out of my pocket financially, I'm going to the hospital. But this is the reason I'm still here, and one of the reasons I'm still here. I have to admit that the nursing staff a nurse is like an angel. Okay, they do more work than the doctors do, and they're a blessing. But I thought Lawnwood did a great job in my heart surgery, and they did an excellent job getting me through this part. Doc, I want to thank you for staying that night. Good thing I didn't have this a half hour later. He would have been home. Okay.
I'd have come back.
With that, Doc, I want everybody, if something is wrong, it's wrong. And just go check it out. Because whatever it is, the quicker you get to it, the easier it is to get past it. Everybody, use a professional. I always tell you that. Have a great day. Doc, thank you. We'll be right back.